So thank you so much, Dr. Aparna, first of all, for joining us for this very, very important event. Because usually when we come to endometriosis or when we come to any kind of pelvic pain, the first thing that we go through is, okay, you need to have a surgery. At least you need to have a diagnostic surgery to understand what is happening in there.
Yeah.
So this is something that is there, and we are going to talk about it. It is a non-invasive procedure to handle maybe not solve the problem, but be able to at least minimize the symptoms.
Yeah.
So thank you so much once again for joining in. I'm going to move ahead. Just for everyone's information, She Deserves Care is basically kind of like my personal journey as well, because I've been struggling with endometriosis for a very, very, very long time as well. मेरी भी एक surgery हो चुकी है 2024 में, and the stats are just shocking. Okay, there are 190 million women who are globally affected, and जो diagnostic time अभी भी है वो 7 से 10 साल है. मेरा खुद का 13 साल था. We have created this beautiful community where we are on WhatsApp. एक informal सा channel है. हम सब अपनी kind of like, you can say, we rant about endometriosis. We rant about different doctors who are there, and we also share different ways how we help each other. So what we are trying to do is we are trying to create a digital health platform as well. Meanwhile, we are supporting the community by creating a directory of doctors, by gathering all the feedback from different doctors, और वो हम शेयर करते हैं फिर हमारी कम्युनिटी से कि यार इस डॉक्टर के बारे में ये बात हुई है, इस डॉक्टर के बारे में ये हुई है, so maybe now you should check this. We have created a global community of doctors as well. Dr. Aparna, if you know, you have been got connected through Dr. Madhu actually. So yeah, so
I work pretty closely with Dr. Madhu.
yeah, so she is the one whom I met in Endo, Dubai, and that's how we got connected. And we just, she has been helping me out generously with a lot of things. We did a session together in March as well.
Oh, okay.
Yeah. We are also trying to work on doctor training. उसमें भी मेरी डॉक्टर मधु से हेल्प हो रही है. So what we want to do is we want to train different gynecologists here who could become endometriosis experts, who could become endometriosis excision specialists.
Oh, wow.
Yeah, who could become pelvic floor therapists as well. So yeah, because यहाँ पाकिस्तान में बहुत कम concept है pelvic floor therapy का. I don't even honestly I even didn't know about this. I will raise a few questions later on, and you will understand like यहाँ पे इतना ज़्यादा इल्म नहीं है इस चीज़ का.
Okay. Exactly.
So that's about She Deserves Care. Like you already, I have introduced myself, and I have Ayman Mubashir, who's and C2, who's helping me build that digital platform, and we are working day in and day out to produce something that is going to help everyone. All those endometriosis patients who are trying to seek their answers as well. So, Dr. Aparna, I would officially like you to introduce yourself as well.
Sure. So, first of all, Assalamu alaikum to all of you. It's a pleasure for me to be in conversation with you guys. This is a very important and very underserviced and underspoken about topic. So, and clearly you can say I'm very passionate about pelvic rehab, and it's closely connected. My name again is Dr. Aparna Kamulkar. I am a pelvic rehab and wellness specialist, and I have a private practice in New Jersey in the United States. That's where I practice. I do offer in-person, virtual, and hybrid sessions. So that was a little snippet about the kind of work that I'm doing. And being a pelvic floor physical therapist, I wanted to share that I work with a lot of individuals that are dealing with bladder bowel issues or pain with intimacy, chronic pelvic pain, and other pelvic floor symptoms that people don't even know are connected to their pelvic floor, honestly, right? तो जब भी मैं किसी को बताती हूँ कि मैं pelvic floor therapist या डॉक्टर हूँ, so there's a 3-second delay usually, and I can see the wheels turning on their from their face. और वो 3 सेकंड में ये सोच रहे होते हैं कि इनको अगला क्वेश्चन पूछे कि what is this, like what is pelvic floor rehab or pelvic floor therapy, या फिर धीरे से टॉपिक चेंज करके let me go somewhere else. So that has been a very common experience that I've had, and that is the level of awareness. If you, you guys were honest enough and candid enough to share कि awareness पाकिस्तान में बहुत कम है, but believe it or not, यहाँ पे भी बहुत सारे लोगों को ये पता ही नहीं है कि ये नॉन इन्वेजिव थेरेपी इतने सारे सिम्टम्स और इतने सारे pelvic dysfunctions के लिए अवेलेबल है. So thank you again for involving me in this, because I am truly genuinely passionate about spreading the word about my profession and what I do. Yeah, Natasha. So that was like a quick introduction about myself.
No, thank you so much, Dr. Aparna, for your time and for your efforts, and definitely to your clinic, Prana Pelvic Thrive, as well, doing an amazing job in pelvic floor therapy. So I'll move to, you have already highlighted how, pelvic floor therapy is important when, if you have painful periods, if you have chronic lower back pain, pain during or after intercourse, any bladder urgency or leakage, pre or post surgical recovery. And this, I'm assuming, not just endometriosis surgery, but any kind of like women are having cesarean every now and then. So
Exactly.
pelvic floor therapy is important even after that as well.
Yeah.
Bloating and any kind of pelvic pressure too. So now I will just have an informal conversation with you, in which I have a lot of questions, and then there are a few questions that the audience also wants to have. So we are definitely going to come to that part too.
Sure. I'm
So
excited.
yeah, so just like in very simple terms, if I have to ask you, what exactly is a pelvic floor and what does it actually do?
Okay. So that's like the foundational question, right? What is the pelvic floor? So pelvic floor is nothing but a collection of skeletal muscles, and I'll explain what that is in a minute. It's a collection of muscles, connective tissue, ligaments, nerves, all meshed up together, and they form like almost like a hammock or a basket at the bottom of your pelvis. So अगर आप imagine करें कि एक muscular underwear है, so that would be a good visual explanation of what a pelvic floor, not technically, because pelvic floor is only the floor, but all these muscles that work together that also include your hip muscles, your lower back. So muscular underwear, just imagine kare, so that is what we are working with when we are trying to resolve pelvic floor dysfunctions. Abhi, like this muscle is basically like the Wi-Fi connection in your house. इसके बारे में कोई बात नहीं करता है, किसी को कुछ पता नहीं होता है. We are always involved in other things, but the minute there is a problem, आपका connection जब छूट जाता है, तभी आपको suddenly याद आता है कि oh wow, like my Wi-Fi is gone and everything comes crashing down, right? So pelvic floor is like that. It's doing a it's a very important system, I want to say. It's responsible for multiple functions in your body, and unfortunately it's very underspoken. It's उसके बारे में ज़्यादा किसी को पता नहीं है. A lot of women, or I want to say a lot of individuals, don't even know where the pelvic floor exists, right? उनको कोई connection ही नहीं है to do anything about the pelvic floor. So that is the state right now. It can, for the kind of work that it's doing in our body, I'm sure it can deserve like a much better PR, I want to say. But yeah, so in terms of functions, what it does, right? Because it sits at the bottom and it holds really important organs like your bladder, like your uterus in females, and the rectum. It is important for your bladder function, for bowel function, for sexual health, And it is also an important structure that gives stability in your body. So it is a structure that turns on and is important with any kind of movement. It's important for posture, for maintaining a good posture. So all these are important functions that your pelvic floor performs. तो जब इस स्ट्रक्चर या इस सिस्टम में कोई प्रॉब्लम आ जाती है तो एनी ऑफ दीज फंक्शंस दैट इट डज कैन बी अफेक्टेड तो एनी all or in a combination. So kabhi kisi ko urinary urgency frequency and leakage hoti hai, kabhi bowel issues hote hain, like people can have either bloating or constipation or pain while passing bowels. kai logon ko sexual dysfunction hota hai, so pain with intimacy. kai logon ko chronic pain, so that's a hallmark of especially endometriosis, but I'm talking in general. So all these people can have movement dysfunction. They're just not able to activate their core and do any specific exercises without hurting them, because your pelvic floor is an important part of providing stability and core strength in your body also. So all these different dysfunctions can happen if your pelvic floor is affected.
Definitely. And if I move to another question that is related to pelvic floor therapy, pelvic floor, what exactly is a pelvic floor therapist? और अगर कोई किसी pelvic floor therapy के session में जाता है, तो what exactly happens in that session?
Sure. So what is pelvic floor therapy, right? तो हमें ये बात तो आपको पता होगी कि कभी भी हमें आजकल काफी common हो गया है कि if someone has shoulder pain or has knee problems, usually people are directed to or recommended or prescribed physical therapy. Right? So physical therapy is basically, it's a field in which the therapist is specialized in treating musculoskeletal and neurological dysfunction. Okay, तो ये pelvic floor physical therapy जो है, it's another super specialized area within physical therapy. So we also work with the similar conditions, like we work with movement dysfunction, we work with what is happening with the nerves, with what is happening with the muscles in that area, but we are specialized in treating the dysfunction that is happening in the pelvic area. Treatment-wise, the therapeutic techniques would involve anything from manual techniques. We are trained to do a lot of manual work, myofascial release, mobility training. Then we use exercise therapy because we understand the entire body and how the pelvic floor, which is just at the bottom, but it is interacting with the entire body. We can actually figure out that कहाँ से इन द बॉडी प्रॉब्लम हो रही है इन द पेल्विक फ्लोर. सिम्टम तो पेल्विक फ्लोर होगा, पर उसका जो रूट कॉज है, दैट कुड बी एनीवेयर इन द बॉडी. एंड आई टच दैट पॉइंट इन अ सेकंड, बट आई एम जस्ट गोइंग टू कंप्लीट व्हाट आर द अदर टेक्निक्स आई यूज. सो दैट इज वन थिंग. वी समटाइम्स यूज बायोफीडबैक. आई डोंट नो इफ यू गाइस हैव हर्ड ऑफ दैट, बट बायोफीडबैक एक टेक्निक है जो टेक्नोलॉजिकली किसी पेशेंट को फीडबैक देता है. सो वी पुट इलेक्ट्रोड्स ऑन द पर्सन in the area where we want to get information from, or the person wants to get information from. So for example, in somebody that has a lot of pain and increased tone in the pelvic floor, we can actually put electrodes in the perineal area, and फिर we teach the person कि वो feedback जो उनके screen पे आ रहा है, वो देख के they can decide whether they need to relax the pelvic floor or engage the pelvic floor. So it's just like a technological instrument that actually gives you feedback about what is happening in your body. And in some cases where there's a lot of pain, where there's a lot of disconnect between your mind and body, it's a precious tool. Then other than that, we use things like heat therapy, or we use cupping techniques, we use several different, so all these are basically, and one thing that I tremendously use in my practice is lots of education. क्योंकि पेशेंट्स जब आते हैं, literally 1/3 of my session I spend in educating the patient, not about stuff, not about fluff stuff that, कौन से area में क्या research चल रहा है, not that education. When I'm talking about education, I'm talking about what is happening in their body, what they can do to minimize the overactivation that's happening. We talk a lot about pain neuroscience because a lot of the patients that I see are in chronic pain, and pain neuroscience is an important component that they need to understand. So those are all the different techniques and therapeutic tools, so as to say, that I use when I'm treating my clients.
Okay. Acha, Dr. Aparna, if I ask you, कि अगर, for example, if I have endometriosis and I have a lot of pain, right?
Yeah.
जैसे कि अभी starting में, we talked to one of the women and she said that like she already had 2 surgeries and she's still in pain and she has been on wheelchair for a while. तो अगर उसको वो pelvic floor therapy start करती है, तो उसका असर like how long would it take कि वो थोड़ा सा उसकी बॉडी में सिम्टम फ्री होने के चांसेस है, लाइक कितना लंबा पीरियड आपको वो पेल्विक फ्लोर थेरेपी, बिकॉज आई नो कि इट्स नॉट अ वेरी शॉर्ट, एक बारी का इफेक्ट तो नहीं हो सकता, आई एम प्रीटी श्योर इट हैज टू बी कंसिस्टेंट, लाइक बट यूजुअली ऑन एवरेज कितना टाइम लग जाता है फॉर दिस टू हैपन?
That's a great question actually, लेकिन उसका आंसर जो है वो डिपेंड करता है कि उनके severity of symptoms कैसे हैं. That's number one, right? How severe their symptoms are. It also depends के how what is the rest of the status in their body. And I'm going to explain this in a minute. Pain जो चीज है ना, that it's very real. I respect everybody's pain level. There is not a moment that I would think, oh my God, this person is not able to tolerate this pain. Absolutely not. As a clinician, I respect that person's level of pain every single time and every single time. Lekin, having said that, I would like people to understand that pain is a very, very complex presentation that happens in the body. Jo pain is not directly proportional to the tissue damage. So to give an example of endo, right? Endo ke different stages hote hain. There is, the 4 stages of endo, and people that have minimal endo, so stage 1, let's assume, right, can have tremendous amount of symptoms. Or people with stage 3 endo can be incidentally diagnosed when they're having another surgery. मतलब उनको पूरी जिंदगी पता ही नहीं चला कि उनको एंडो है, लेकिन when they went for some other kind of surgery, the doctors find out that, oh, this person had endo. ये भी हो सकता है. So now, because of this situation and this clinical presentation, that tells us that tissue damage is not directly, your pain level is, or symptom presentation is not directly proportional to what is actually happening in the tissue damage. Now, what are the other factors that are going to affect that pain level? It is your overall health. आपके बॉडी में कितना इन्फ्लेमेशन चल रहा है, आपका स्ट्रेस लेवल कैसे है, how are you able to sleep, what is your energy level, what is your emotional status, and most importantly, what your prior experiences with pain have been. They're very closely connected. So pain can be addressed. Now, understanding this whole scenario, the pain can be addressed by addressing all these different aspects that are contributing to the pain. So coming back to your question, kitna time lag sakta hai? For endo and chronic pelvic pain, I've seen longish time frames, looking at least, most of the endo patients that I see stay with me for an average of 18 sessions or 18 weeks.
Okay.
Yeah.
Okay. So, but still, I think 18 weeks भी अगर आप लगा लें और 18 weeks में बीच में बेहतरी feel होना शुरू होती होगी, तभी they would be coming.
Yes, definitely. So I want to say in about 3 to 4 sessions, आपको कुछ ना कुछ तो difference feel होना चाहिए. और अगर नहीं हो रहा है तो then you have to communicate that to your therapist or your provider so that they can, that is what I follow in my practice, right? Always, every session I'm assessing a little bit. Every session I'm reevaluating what we did and how their body has responded. And वो बहुत अलग होता है, varies a lot between patients. So I'm constantly communicating, pivoting. किसी पेशेंट्स को कोई एक्सरसाइज से बहुत ज्यादा पेन बढ़ जाता है, किसी को किसी टूल से, like I mentioned all the different techniques, some techniques really work magically with patients. There is one more technique which is called the visceral mobilizations, which is a newer advance in even within pelvic floor rehab. It's a newer advance that I'm trained in. So I am actually working with the visceral organs. तो उससे काफी फर्क पड़ता है. Like, you know, people really get a lot of relief from that, so to say.
Sorry, when you say visceral organs, like what does that mean
So
for the layman audience?
yeah. So basically, think of it, it's a manual technique, first of all. So my hands have to be on that patient. This is not something that I can do virtually. You know, this part, my hands have to be on the patient. But what I do is I place my hands on the patient's belly, and through certain techniques that I've learned, I try to influence the movement that's happening in the specific organs. So movement happening in the uterus, movement happening in the bladder. So think of it this way, कि all our organs are in either the pelvic cavity or abdominal cavity, right? लेकिन हमें जैसे लगता है कि visceral organs are just static, like they're sitting there in one place. वैसे नहीं होता है. Obviously, they're not walking around in my whole body. You know, that's a given. But every organ has a small amount of physiological movement. जैसे with every breath, your liver is moving down, up and down, like literally few centimeters. As the bladder keeps filling, it keeps moving up slowly. तो वो जो थोड़ा सा physiological movement होता है for each organ and between the two organs, right? Depending on the cycle of a woman, the uterus position changes a little bit. Depending on how full the bladder is, that changes. Depending on what the colon is doing, the colon also has to move stuff down into the rectum. तो वो जो movement है, वो कई बार in cases of chronic pain, because of the guarding response of the brain, everything kind of tenses up. You know, just like the muscles tense up in the area, the organs also tense up. And फिर वो physiological movement कम हो जाती है उनकी, उससे symptoms बढ़ जाते हैं. So what I do with my visceral mobilization therapy is that I try to regain that mobility back through fascial connections, through like connective tissue connections, and that has worked in my practice. It has worked really well for chronic pain patients.
Perfect. Dr. Aparna, thank you so much for this. क्या इसमें I would like to ask कि ज़्यादा बेहतर effect आ सकता है when you do it pre-surgery, and now I'm talking about endometriosis specifically, and जो आप बात कर रही थी, अब bladder fill हो रहा है तो bladder obviously move कर रहा है, it need more space, right? And मसला ये होता है endometriosis में कि everything gets, you know, together,
adhesion, scars, inflammation, and sticky. Everything gets sticky.
So वो जो sticky हो गया है, तो वो जब बढ़ रहा है, तो जिस तरह के I know that मुझे अगर मेरा bladder ज़्यादा fill होता है, मुझे जल्दी से washroom इसलिए जाना होता है. एक तो सबसे पहले definitely I have a weak pelvic floor because of endometriosis and the surgery too, but also because I actually have pain. If I want to go to pee, I have pain and I have to just go and release myself so that I'm not in pain. And that's so difficult to explain to someone who just doesn't know that ये pee की वजह से इतना ज़्यादा क्यों आपने washroom जाना है, because it's like I'm in pain, that's why I have to go to the washroom. अच्छा, इसमें मुझे what I want to understand is कि can a physiotherapist also become a pelvic floor therapist? या ये एक अलग बिल्कुल field है? And then anything that you know about osteopathy. I know that one of my friend is in Germany and she got osteopathy, and it was kind of like weird for me to listen to what osteopathy looks like, but it was like you go internally and they massage organs.
Yeah. Yeah.
And उन्होंने मुझे बताया कि पहले सेशन में लाइक एक ही सेशन में जो उनको वल्वा पेन था, ठीक है, रेक्टम पेन नो, बिकॉज इट वाज
Yeah.
इट couldn't do anything to the rectum pain right now, because उन्होंने कहा कि मुझे उसके लिए I'll have to go inside the rectum to, you know, release those adhesions, to release those scars. But she definitely said कि मेरा एक ही session के अंदर, just one session of osteopathy, and she said that कि मुझे उससे बहुत आराम आया इन द वल्वा, व्हिच शी सेड दैट आपको मैं इसी के लिए टारगेट कर रही हूँ. एंड सो लाइक आई डू अंडरस्टैंड, बट मुझे लग रहा है कि एंडोमेट्रियोसिस में सब कुछ जो चिपक जाता है साथ, मे बी द मसाजेस और द मे बी द ब्रीदिंग प्रैक्टिसेस या जो भी चीजें होती हैं जिसके बारे में हम आपसे पूछना भी चाहेंगे लेटर ऑन. Maybe that's the reason कि endometriosis में आपको आराम आता है उससे, because वो adhesions separate होती हैं.
Yeah. So that's very interesting. Okay. And that is going to actually tie back to what I explained about pain and the symptoms and आपके body में क्या हो रहा है. Right? So there are two aspects, and maybe I'm jumping the gun and I'm sharing more information about this topic right now before we, but that makes sense क्योंकि आपने अभी ये question पूछा. I really want clarity, you guys to have clarity around this. Any person that's experiencing symptoms and that has endometriosis, जरूरी नहीं है कि उनके सारे symptoms are related to only endometriosis. क्या होता है कि they've had endometriosis for so many years. Now, आपने बताया कि in your case, 13 साल लग गए थे before you even got the diagnosis of endometriosis.
That I did myself too.
Yeah, and in those 13 years,
Yeah.
imagine how many experiences of pain, and not just pain, but being dismissed, not having answers, just feeling so like, you know, frustrated and scared in your body कि ये मुझे क्या हो रहा है कि किसी को पता ही नहीं चल रहा है कि और इसका कोई ये मसला है, लेकिन nobody has the answers, nobody knows what to do about it. How much of a fear response, or like how much of fear your brain is in, right? So as the endo keeps increasing, उसकी वजह से adhesions, scar formations, inflammation, वो सब तो होता ही है. But in addition to that, every pain experience you've had in so many years, what happens is that is reinforcing the brain, your brain, to go into a protective response. And that is a very normal response. This fight and flight response is something that happens in every human being, in every body part, in every situation. It's not something specific to endo. किसी को अगर neck में अंदर neck in the spine, if someone has a disc problem, अभी problem तो अंदर है disc की, पर यहाँ के जो muscles हैं वो बिल्कुल tense हो जाते हैं. क्यों? पेन हमें बाहर क्यों हो रहा है, अंदर क्यों नहीं हो रहा है? That is because as soon as the disc starts protruding and pushing on some nerves or whatever, the brain senses के, oh my god, like there's danger. And what the brain does is वहां के सारे organs या parts को it tells, okay, it's a protective response. Your brain is doing it for a good reason, right? It's doing it for a good reason that wahan pe zyada movement na ho, let me protect that part. And everything goes into like a guarding response, right? The same thing happens with endo. Endo ka pain jab aapko in the process of 13 years, jab aapka endo badh raha hai, every single time you got a pain, your brain registered it as a danger in you and told that part, told the pelvic floor muscles, told the organs around it, all right, freeze, just freeze, something wrong is happening in your body. So now the symptoms that you are seeing are not just connected to the endo, which is obviously causing a lot of pain, inflammation, and the symptoms, but it is also connected to all the other guarding response that's happening in your body. And that explains why if there is early diagnosis of endo, yeah, chronic pain is addressed with some kind of therapy early on, कि किसी भी person को इतने सारे साल they don't have to endure that pain that the person develops a totally whole other issue that also needs to be addressed along with the main cause of it. Then they will be in a much better situation to deal with the with that diagnosis. In this case, in this
Yeah.
case.
So, like you talked about frozen pelvis as well, ठीक
Yeah.
है कि वो freeze हो जाता है सब कुछ, right?
Yeah.
तो मतलब मुझे honestly, because I've had that before the surgery,
Yeah.
तो मुझे बाकायदा तौर पे like towards that left side where the cyst was, which was huge as well, तो वो भी साथ में सब चिपका हुआ था, तो like I would feel scared कि यार ऐसा ना हो, मतलब मेरे दिमाग में जो image आता है, मैं आपको बता रही हूँ, like not from a doctor's, from a patient's perspective, कि something is stuck together and जब वो separate होगी तो उसमें तकलीफ होगी. तो do you think कि एक pelvic floor therapy का process itself भी तकलीफ दे हो सकता है for the patient?
So that's a great question. कई बार ट्रीटमेंट में ऐसे होता है कि I provide a treatment and the person's pain can increase. हो सकता है ऐसे, क्योंकि ये जो ट्रीटमेंट जब मैं शुरू करती हूँ, people have not experienced any of that before, right? So when I am treating, their symptom presentation can get worse, but their situation, their clinical situation is not getting worse. That is again a response that their body is giving to the treatment. आपको एक, I mean, this I've not even thought of sharing this, but this is a very interesting case. I worked with a lady who was about, I think she was about 63 years old, okay? Oh, no, she was younger, like 50s mein hongi, late 50s mein. Throughout her life, she had experienced pain, which was cyclical in nature. And then she started experiencing urinary urgency, urinary frequency, to a point where when she was almost getting her periods, her life was shut down. She was not able to participate in any social activities. कहीं जा नहीं सकती थी, क्योंकि like she had to sit with a heating pad, like just sit there with the heating pad. She came to me and we started working together. First 2-3 sessions, so I do general stuff, I do some internal work and all that. Then I started doing my visceral mobilizations, okay? That visceral, like she came the next time and she said, Dr. Aparna, I really have to share this with you. When I left from here and I sat in my car from my clinic, she sat in her car, she said, I don't know what was happening to me. मुझे suddenly लगा कि मेरी पूरी energy drain हो रही है. मुझे लगा कि मुझे मेरे husband को बुलाना पड़ेगा to pick me up. I did not know what was happening. Like I don't know whether it was pain, because it wasn't severe pain, but it was a weird kind of a response, right? And then, so she was narrating this a week later, right? So then I asked her, okay, then what happened? Then she said that I sat there for a few minutes. I kept doing the breathing exercises that you had taught me. And then I was able to go home. For a day or two, it felt weird. I was in discomfort. But after that, I really started feeling so much better than before I came to you. So आपने जो भी किया, please आप करें वो. क्योंकि, I don't mind bearing that little bit of discomfort and pain, but if it can get me to a point where I'm going to start feeling better, I can. So again, coming back, anchoring down to your question, can it make it worse? It's not going to make the condition worse, but I have been in situations where their presentation can get worse, but that is up to me as a clinician to pivot and navigate and see what the patient can tolerate, what they cannot, and change my treatment accordingly.
So basically, abhi aapne jo mention kiya, and I was talking about my friend as well. So when she went into that session, the doctor already informed her कि हो सकता है आपको हल्की सी dizziness at the end of the session feel हो, या आपको बहुत ज़्यादा नींद आए, like you are so sleepy, you want to just rest because your body is done doing that. So I think that is something, because आपकी body बहुत ज्यादा एफर्ट पुट कर रही थी एंड नाउ उसको थोड़ा सा रेस्ट चाहिए. सो यस, दैट डेफिनेटली इज. अच्छा, एक क्वेश्चन मेरा और है रिलेटेड adenomyosis as well. Endometriosis की evil twin sister is adenomyosis. तो एडिनोमायोसिस में भी कोई आराम आ सकता है? बिकॉज जो सबसे ज्यादा मुझे लगता है कि जो लाइक yes, definitely endometriosis is there, but adenomyosis की वजह से जो आपको heavy blood flow होता है, क्या pelvic floor therapy की help से कोई ऐसा like reduction in that blood flow भी होता है, या it's just like symptom of pain that gets reduced?
Yeah. So just for the benefit of everyone that's listening, I'm just going to quickly explain what adenomyosis is because some people may not know. So
Yeah.
endometriosis is इसमें क्या होता है कि uterus की जो अंदर वाली lining होती है, वो cells they're only supposed to be in the inner lining of your uterus, and they start growing everywhere in the body outside of that uterine lining, and that is what we call endometriosis. एडेनोमायोसिस में क्या होता है कि वो जो इनर लाइनिंग में जो सेल्स होते हैं वो यूट्रस के मस्कुलर वॉल्स में ग्रो होना शुरू कर देते हैं, एंड द प्रेजेंटेशन इज प्रीटी सिमिलर. इट्स वेरी सिक्लिकल प्रेजेंटेशन, सिक्लिकल पेन होता है, सुपर डुपर वेरी heavy menstrual cycle, very painful menstrual cycle, so dysmenorrhea and all those things. Now answering your question कि physical therapy में इसका can physical therapy benefit this? Well, physical therapy will not change the blood flow. Okay. It will not change what is like it will not change the clinical presentation of adenomyosis, because that is something totally related to what is the structural changes that are happening. But as I mentioned before, because of so many pain experiences, if the other tissue around the uterus has gone into a guarding response, let's say the pelvic floor has increased tone in the pelvic floor, which is then contributing to your bladder symptoms कि आपको pelvic floor इतना tense हो गया है and it's pressing on the urethra कि आपको every 20-30 minutes आपको void करने जाना पड़ता है, या आपको because of the tension in the pelvic floor you're not able to pass bowels easily. Passing bowels can become painful. So those symptoms which are technically happening indirectly because of the adenomyosis will 100% change and benefit from pelvic rehab.
Okay, perfect. So जैसे कि मैं अगर अपनी एग्जांपल लूं, ठीक है, so I've had my surgery in 2024 like I mentioned, और मुझे होता था like I used to have a lot of pain peeing, or whenever I have to poop, right? I did have, whenever I had bowel movements I used to have a lot of pain. Yeah. But post surgery अभी recently मुझे ज़्यादा हुआ है जो मैं आपको बताऊंगी, and you can tell me if that's going to change if I do go for pelvic floor therapy even now. मतलब अब तो ज़्यादा time हो चुका है post surgery, post op, but I should have gotten it done post op actually, foreign से, but honestly we didn't know about it. I didn't know about it. अगर मुझे पता होता I would definitely have considered that. So what happened was we love to go for hiking, right? तो वहाँ पे कोई आपके लिए washrooms तो available नहीं होते हैं, and we were in a place where it was like it was daytime and in the morning, and there were a lot of people around me as well, but it got so difficult for me to reach a spot where I could actually release myself. Yeah, and that had been happening since a while now, like since 6 months now. Okay, there would be a very sudden urge, like it aisa nahi hai ki it was building up or anything, and I was aware of it. It was like a very sudden urge to go and just go right now. Ab agar aap travel kar rahe hain, aap kisi ke saath hain, to aap kya kare, like it's really embarrassing as well, right? Yeah. So I just want to understand ki agar for example I do go for pelvic floor therapy, this is just a case study for you as well, कि अगर मैं जाती हूँ तो you think that वो जो मेरी अर्ज है या जो मेरा कंट्रोल लूज हुआ है ओवर द बाउल, दैट कुड इम्प्रूव?
Definitely. I mean, obviously, every person is different. Every presentation is different. I don't want to say any guarantees, but in my practice, I've seen a lot of patients get better with urgency and frequency. Pain unka hota hai, but pain doesn't go away. We teach because chronic pain stays for a long time. It takes a long time to really get over. Chronic pain conditions mein my main goal is to train the person to deal better with the pain. ज्यादातर ये गोल नहीं होता है कि पेन कंप्लीटली चला जाए, because that will take a long time and people cannot come to therapy for that long. But by the time they are discharged from therapy, or I try to wean them off, at least they are in a place where they are able to deal with their pain a lot better. And because they are able to deal with the pain better, their perception of pain, their level of pain goes down. And definitely surrounding symptoms like urinary urgency, frequency, bowel issues, pain with intimacy, all those tremendously improve, in my experience, at least with pelvic rehab.
अच्छा, सिंस आप यूएस में हैं, न्यू जर्सी में हैं, हम पाकिस्तान में बैठे हुए हैं, यहाँ पे इंडिया से भी लोग हैं हमारे पास, तो हम लाइक वी कैन नॉट बी देयर फॉर यू कि आप हमारी थेरेपी कर सकें, और पाकिस्तान में आई एम नॉट इवन अवेयर कि हमारे पास हैं भी नहीं है, अगर हैं तो उनको ट्रेन करने की डेफिनेटली जरूरत है. बट सारी खवातीन जो यहाँ पे हैं एंड हु आर इन क्रोनिक पेन और हु वांट टू एक्सपीरियंस pelvic floor therapy, जैसे कि बहुत सारे लोग कहते हैं यार कीजल्स कर लें आप, कीजल एक्सरसाइजेस कर लें आप, राइट? तो in terms of that, what do you think? Do you think is there anything people can do at home which would help?
Okay, first thing that I want to say is Kegels exercise has become like, Kegels exercise kya hai? It's a name given to the action when you actually contract your pelvic floor. That's it. So it's like synonymous to biceps curls. जब आप अपने elbow से curls करते हो, right? That is biceps curls. Now the thing is, it's been so overused. The reason being, लोगों को पता Kegels के सिवा और कुछ पता ही नहीं है. That's the only thing that was popularized several years ago by a doctor named Kegel. And Kegels exercises just exploded on the internet. And हर कोई Kegels, मुझे तो ऐसा लगता है कि आपका वाईफाई भी डाउन हो जाए ना, आपको बोलेंगे अच्छा आप Kegels कर लो, ठीक हो जाएगा. It's so frustrating though, because especially in conditions with chronic pain, like I explained before, your pelvic floor muscles tend to be in a tensed situation. आपने
अच्छी नहीं होगी मेरा ख्याल है.
हाँ?
Do you think उसमें Kegel अच्छी होगी? Like
no,
if
that's what I'm saying. What to do at home? First, stop doing Kegels. That is my first advice to you, or anybody that's listening. Anybody with pain in my practice, when a pain patient comes to me, unless and until they have decreased their level of pain and learned to relax the pelvic floor muscles with my training, and I am actually able to go in, palpate those muscles and see कि वो ठीक तरह से relax कर पा रहे हैं या नहीं, we don't even talk about the K of Kegels. No, like I am not telling anyone to do a contraction or engagement of that pelvic floor muscle, because that muscle is already so tense. अगर एक tense muscle को आप और बोल रहे हो कि okay जोर जोर से उसको activate करो, it can seriously increase your symptoms. All the symptoms. It can increase your level of pain, it can increase your urgency, frequency, everything, because it is increasing the tension that's already there. तो उससे कोई आपको स्ट्रेंथनिंग का इफेक्ट ही नहीं आ रहा है, बट आपको ये मसला और वर्स हो रहा है कि the pelvic floor is getting more tense. So the first thing that you have to learn in therapy, and that will tell you whether your pelvic floor physical therapist is a good therapist or not. You know, that is an important aspect of this. Kegels na kare. Focus on relaxing and lengthening that part. Usko kaise let go, right? You know,
बहुत ज्यादा मैंने सुना है, sorry I'm cutting you off as well, diaphragmatic breathing.
Yes, yes.
I've really heard about that as well. तो कोई इस तरह की कोई 3-4 exercises या anything that you would recommend for all the women who are here?
Yes. So diaphragmatic breathing is abdominal breathing, right? Jo, you know, when you inhale, your belly comes out, and when you exhale, you let it go. You're not squeezing your belly in, but you just let go, and everything returns back to the resting position, right? That is called diaphragmatic breathing, and zarur uska, like, you know, it's very effective. in more than one ways. It's effective in helping you lengthen the pelvic floor, but it also helps in calming down your brain, getting it out of that fight and flight response. So it really helps you in a lot of different ways. But there's another thing that I'm going to mention, which you may or may not have heard, I'm not sure, is 360 degrees breath. And or it's either called 360 breath, or it's called circumferential breathing, or it is called sometimes umbrella breath. Okay, so ये भी एक चीज है जो मैं मेरे सारे clients को, especially pain वाले clients को सिखाती हूँ. And I don't think we might have time for me to actually teach you that, because I see
Somebody has already asked that question.
Yeah, I don't know. It takes time, because it really takes like almost, it's half of my session in my clinic, and then it also needs a lot of reinforcement and practice and everything. But I've promised that what I can do, Shaiza, is I will make a video of it and post it on my Instagram. And you guys will have access to it. And Natasha, if I forget, please nudge me, because I'm doing so many things. That's a promise. And like, if I make a promise, I'll make sure that I'll do it. I will definitely put a video of this. Yeah. And I'll share it with you, so you can share it with all your viewers. But I'll just tell you कि वो क्या होता है. Diaphragmatic breathing में हम बोलते हैं कि belly को expand करो. लेकिन diaphragm जो होता है ना, that is like a flap-like muscle which sits right underneath your lungs and above your abdominal canal.
Okay.
Does that make sense?
Yeah.
Yeah.
So it's kind of the ribs wala area.
Yes. So I'm going to stand up. Okay. Let me stand up so you can see. So ऐसे बैठता है वो inside my body, flap जैसे. So it's underneath the thoracic cage and it's above the abdominal cage or abdominal canal. Okay. तो वो जो muscle है, that is the main muscle of respiration. It's the main muscle of inspiration. Okay. Inspiration means हम जब inhale करते हैं, तो वो जो diaphragm होता है, that flattens out. Okay. So when that flattens out, आपका जो diaphragm and your pelvic floor, which is sitting underneath यहाँ पे, right? They work like a piston. जब आप inhale करते हो, ये diaphragm नीचे चला जाता है. When नीचे जाता है, तो it puts pressure on all the organs in the abdominal canal, and then the pelvic floor also goes down with it.
Perfect.
Okay. So this is the little movement that I was talking about. के bodies में, सारों के body में थोड़ी बहुत movement होती है, right? So every time your diaphragm goes down, your pelvic floor gets an opportunity to go down as well and relax and lengthen. Okay. Now we breathe. How many times do you think we breathe, guys? Any guesses in the audience in a day?
We stop breathing. We forget breathing sometimes.
Yeah.
So anyway,
our nervous system is set so.
Yes.
Flight and fear में ना रहने की वजह से.
Yes. So Shaiza,
मुझे याद करना पड़ता है कि यार, you have to breathe. Come on, breathe.
Yeah, and that is why breathing exercises help you so much. Okay, so where I was coming from is आपका diaphragm and आपका जो pelvic floor है, it works like a piston. Both of them go down on the inhale, they come up on the exhale. अभी हम जब सिर्फ diaphragmatic breathing या abdominal breathing में focus करते हैं, तो we are not ensuring that the whole diaphragm is moving down. सिर्फ आपका front वाला जो part है, क्योंकि आप belly expand कर रहे हो, आपका फ्रंट वाला पार्ट नीचे जाता है, पीछे वाला जो पार्ट है वो स्टक होता है on your spine. मेरे पास एक ऐप है बहुत like it's really but I don't know how I would show you. I'm going to try to show you what that is. Anyhow, but that's like going more into the clinical details. If you want to believe me कि आप ऐसी exercise करोगे, breathing in such a way that your entire diaphragm moves down, your entire pelvic floor gets an opportunity to go down and lengthen as well. And that is what I teach in circumferential or 360 degrees breath. 360 degrees breath mein I don't focus only on the belly, I also focus on the ribs and the back and the whole expansion of your rib cage like an umbrella. आपका पूरा ribcage जब umbrella जैसे open होता है, तो the whole diaphragm gets an opportunity to descend, and then because the entire diaphragm moves so well, your pelvic floor also gets an opportunity to completely relax.
Acha, Dr. Aparna, do you think you will, like, I'm pretty sure there are so many resources available.
Yeah.
आप हमें बना के तो देंगी, definitely we'll wait for that. But कोई ये जो बाकी exercises हैं या कोई pelvic massages होते हैं, ठीक है?
हाँ.
कोई अगर आप हमें इस तरह की list of 3-4 exercises or anything
Sure.
that you could share with
Sure.
all of us,
Sure.
ताकि we could just, start doing it. And everybody who is doing it can share their reviews with us, and we can definitely let you know as well कि क्या उनकी progress हो रही है उससे.
Yeah.
तो अगर इस तरह की कोई exercises हो आप share कर सकें, और अगर आपकी videos बनी नहीं है, that's great. अगर नहीं, तो if there is any reference YouTube link that you could share with us too, जो हम उनके साथ share कर सकें.
Definitely, I will do that. Give me just a little bit of time, maybe like a week or so, and
ठीक
I'll
है.
have that to you.
Done.
I'll get it over to you.
Perfect.
बहुत
So,
सारी resources हैं. The first thing that I would highly recommend is focus on breathing. Focus
Okay.
on a lot of stretching rather than strengthening. हमें strengthen नहीं करना है अभी. हमें strengthen right away कुछ भी नहीं करना है. Your whole body is tense. We want to teach your body to just let go and lengthen. We
Relax.
want to teach your body that it is safe for me to even breathe. जैसे Shaiza said, कि breathe भी नहीं करते हैं हम, because we are in so much pain and इतनी सारी guarding and protective response that you're not even able to breathe. How can a person function without that breath? That is so important for every other organ and system in our body.
Definitely.
So,
Dr. Aparna, we have very little time left, and I want to open the floor for the audience as well. But कुछ हमारे पास gynecologists भी मौजूद हैं यहाँ पे.
sure.
And I really want you to highlight the importance of I think that gynecologist and a pelvic floor therapist should go hand in hand actually.
Absolutely.
It shouldn't be separate कि हाँ ये अलग एक है शोभा और ये अलग है. I think both of them need to be synchronized on a patient too. So is there anything that you would like to mention या कोई recommendation हो आपकी especially for gynecologists कि कैसे आप लोग मिल के काम कर सकते हैं, because eventually patient के favor में ही आप सब काम कर रहे हैं, right? तो patient को फायदा आप सब ने करना है. तो आप कोई recommendation or anything कि आप दोनों मिल के कैसे काम कर सकते हैं for the benefit, for the bigger picture?
Yeah. I would love to be in that ideal world. क्योंकि endometriosis जो है condition, we all know that it's a multi-organ. It's not just a reproductory system dysfunction. We've seen how it begins with reproductory system dysfunction, but then it also extends to so many other organs that are in the vicinity, and also affects the pelvic floor, which indirectly causes so many symptoms, like we went over so many times in this conversation. Right now, I really feel that gynecologists have a tremendous role in handling the medical and the surgical aspect of endo, while pelvic floor physical therapists, we work on the musculoskeletal system, the nervous system. और ये दोनों की बहुत ज़रूरत है. These are not two overlapping fields. They are fields that complement each other. They cannot replace each other. जो काम मैं करती हूँ as a pelvic floor physical therapist, I don't think gynecologists are trained to do that. And obviously, like when I have patients, I'm not talking although I know about what medications, that is for my knowledge, and that is for me to make the correlation when I see symptoms and stuff like that. But obviously, I'm not prescribing any medications to any doctor, any patient. That's totally out of my scope. But मुझे ये लगता है कि endo, in my experience, I've always seen, in fact, any chronic pain, the more the specialists are involved in the care and the more they communicate with each other, the better are the outcomes. क्योंकि हर एक specialty का अपना वजूद है. Like, every specialty has its own importance, its own identity, and its own like very niche work to be done with any patient, and especially with endo. So I truly believe कि सारे specialties अगर मिलके refer करें एक दूसरे को. I see so many patients in my practice, Natasha, that I refer to the gynecologists and endosurgeons. अभी एक लड़की आई है मेरे पास. She's like 22 years old, and she came to me for dysmenorrhea, for severe periods, because, and कैसे, not because of awareness. She didn't know that she had to see a pelvic floor physical therapist, but she found out from her personal network that I help with any kind of pelvic pain. She's a personal, like somebody, kisi friend ke friend ki beti hai. So she came to me, and then I started treating her. She started feeling better already in her periods. The pain level has started going down. She's doing all the right things. She's doing the breathing exercises. She's doing guided slow movement. She's keeping herself healthy. But I really pushed her. I said, no, you need to get a consult with an endosurgeon. And believe it or not, she had endometriosis, and she is lined up for a surgery in July now. So,
Exactly.
that kind of thing, the referral is both ways. It's not that only gynecologists, but I would love for gynecologists to understand that other than the medical part of it, there is a lot of work to be done in endometriosis, and pelvic floor physical therapists are trained and equipped to take care of the musculoskeletal and neurological components of endocare.
So I think also regarding a question यहाँ पे food related भी आया हुआ है, तो do you guys also like recommend कि यार ये खाना, ये food नहीं लेना, consume करना, या ये करना है? And there's this specific question like as what is good for pelvic floor or sexual or reproductive health for a woman.
Yeah.
I believe सारे whole foods definitely, and avoiding fast foods. But उसके अलावा, if you think you have anything in mind that you would want to recommend.
So ये जो चीज है ना, like it's very ethos based. मतलब in my practice, if you see my website, you'll know that I'm a very holistic pelvic floor physical therapist. So I provide evidence-based therapy, but I always, for any patients, not just endo, I always touch on the other foundations of pelvic floor physical therapy within my scope. So I'm not clearly a nutritionist. I cannot tell you exactly what to eat or not to eat, but I have taken courses and I've been educated about a few things. I would highly recommend in endo trying to go for anti-inflammatory diet. So like lesser amount, like try to cut out processed food, try to cut out sugar, because sugar and processed food can cause a lot of inflammation in the body. Try to work with somebody that can help you improve your gut health. उसमें बहुत सारे nuances है. One of the basic things that I do is to improve their bowel health. Anybody that is able to pass bowel movements every day will indirectly have a better gut health. क्योंकि उनका जो stool है, that's not getting accumulated in the body. It's getting evacuated the way it should be. So we do all kinds of things. Like I give recommendations like making sure that you're taking your magnesium, you're taking your fiber intake. Fiber hamesha, at least in like I do a lot of Indian cooking, so I'm talking from my perspective. I feel like everybody says, oh, the diet is really good, we eat home cooked meals, lekin utna fiber content, 25 to 30 grams of fiber consume karna बहुत difficult है. So I recommend taking fiber supplements. And the two ones that I highly recommend in the beginning to try out is, one is organic psyllium husk, and two is sun fiber. I don't know if you guys...
Psyllium husk is basically ispahol that we consume.
Yes, it's a goal. Yes. Okay. That is what it is. So you can try that. Sometimes people can experience bloating with that. So har ek ki body kaise respond karti hai, you have to take care of that. You have to, watch that. But you doing that using squatty potty. Are you guys aware of squatty potty? Kya hoti hai?
Like you sit in that Indian toilet position?
Indian toilet position.
Yeah, it's this thing. Yeah, definitely.
So basically, abhi aajkal sare, like, everywhere here, there's Western toilets. So we cannot find that squat that we used to. Aajkal to India mein bhi main visit karti hu, to saron ke paas, even my mom doesn't have an Indian toilet, right? So but what we do is we put a step stool and we raise our feet and put our feet on the step stool.
Make one for me. I'll send them.
Yeah, and it's such a simple way of doing it. Such a simple way of doing it, right? You just put like something underneath your feet. The feet doesn't have to be any fancy thing. Kuch bhi rakh sakte ho, like stool or block or whatever, and your feet are raised, and then you can find that squat, and it helps you evacuate so much better. So
Yeah.
now think about it that we are talking about bowel health, which is totally different from pelvic pain, but it is an important aspect क्योंकि आपका अगर bowel ठीक होगा तो there won't be so much pressure on the bladder, then your bladder symptoms start improving, then your overall feeling starts improving, and then your chronic pain, which is coming actually from the endo, the perception of that pain can start going down, because now you're not being like pulled in 30 different directions and experiencing like some kind of a problem in every other system in your body, right? You're like minimizing that impact.
Okay. We do have, I'll open the floor for questions. Dr. Aparna, sorry, I've taken 1 hour of yours already, but maybe
No.
you could stay for 10 more minutes if that's okay.
Yeah, I can stay for a few more minutes. That's totally fine with me.
So before we move on to the questions from the audience, I would like everyone to turn on their cameras, whoever is comfortable, not all of you. If anybody is comfortable and wants to have their picture taken, please do so. Otherwise, it's completely fine as well. We'll use that for our social media as well. Eamon, you can go ahead. And 1, 2, 3.
Oh, sorry.
You should get one more.
1,
Okay.
2, and 3. Perfect. Thank you, guys.
Oh, Tuba is here now, but we have already. Can we take one more?
Sure.
Thank you.
3, 2, 1. Great.
Perfect.
Thank you.
Right. So we'll open the floor for questions from the audience. And if there are any unanswered questions, Dr. Aparna, I'm going to share that on an email with you from the forums that we have received. And you could just, respond to me on the email. And yeah, we could do that. So Shaisa, you did have a question. Please आप unmute करके अपना सवाल पूछ सकती हैं.
यस सबसे पहले तो मेरा क्वेश्चन ये है कि आपने जैसे बताया पेल्विक फ्लोर जो थेरेपीज हैं उसके साथ मेडिसिन जो है वो साइड बाय साइड जा सकती है. फॉर एग्जांपल समटाइम्स डॉक्टर्स एडमिनिस्ट्रेट यू द प्रोजेस्टेरोन एज अ एंटागोनिस्ट टू योर ईस्ट्रोजन, स्पेसिफिकली इफ दे फाइंड आउट कि आपका एस्ट्रोजन डोमिनेंट है. Does that help with pelvic floor therapy? Do you recommend?
Yes, absolutely.
Okay. And
Absolutely.
second question.
Go hand in hand. Like I said, neither one can replace each other, right? Medical जो treatment है उसकी अलग जगह है, pelvic floor की अलग जगह है. They beautifully complement each other. So yes, absolutely.
Second question मेरा ये है कि जो नॉर्मली sciatic nerve pain होता है नॉर्मल लोगों में, जिनको एंडोमेट्रियोसिस का नहीं है, उनका जो सबसाइड का टाइम है, सबसाइडल टाइम आफ्टर ट्रीटमेंट, क्या वो और उनके साथ जिनका एंडोमेट्रियोसिस है उनके साथ जो है वो मैच करता है या that would be different?
I think it would be different, considering that both the individuals, let's say one person has sciatic pain and is doing therapy, is doing all the right things, and the other person has sciatic pain and endo and doing again the same kind of therapy, right? The person that has endo also has so many other things to deal with. So
Yes.
absolutely, the time frame for improvement and even their symptom presentation is going to be a lot more with a person that has endo compared to somebody that has only sciatic pain and nothing else going on in their body.
ये क्वेश्चन मैंने इसलिए पूछा था कि क्या पीएफटी में हमारी जो ऑब्ट्यूरेटर इंटरनस मसल है या एक्सटर्नस मसल है अलोंग विद द पेन, नर्व पेन, क्या वो भी उसके साथ जो है वो ट्रीट हो जाएगा या उसके लिए अलग से ट्रीटमेंट प्लान चाहिए होगा या उसके लिए अलग से हमें जिसे कहते हैं टाइम निकालना पड़ेगा या ट्रीटमेंट प्लान करना पड़ेगा?
Yeah, so pelvic floor therapy that is ideal and that I offer has to be somebody who has advanced training. जैसे I am trained to do a lot of vaginal and rectal internal work. आप जो obturate, internal treatments, मतलब I actually insert in the vaginal canal to either stretch or do manual techniques in the structures that are inside. जो pelvic floor muscles होते हैं वो ज्यादातर layer 1 जो बाहर के muscles होते हैं, you can palpate them from outside, but there are 3 layers of pelvic floor. जो अंदर वाले layers होते हैं उनको direct access सिर्फ आपके vaginal canal या rectal canal से ही मिलता है. Definitely the obturator internus muscle, I treat a lot with internal techniques. So if the therapist that you're seeing is trained to do that, obviously, I mean, they really have to be trained, and they better be trained really well, because this is not something that you can play with, and this is not something like a Me Too movement, ke mujhe bhi aati hai, main bhi kar lungi kind of thing, you know. That person has to be really trained, responsible to do, they should know what they're doing basically. But yes, usse काफी फर्क पड़ता है. I work with a lot of people with combining my visceral mobilizations with the internal techniques that I use. तो उससे काफी आराम होता है लोगों को. Like people really start feeling a lot better. Yeah.
ये क्वेश्चन एक्चुअली पूछने का मकसद ये था कि जो YouTube पे आप काफी सारे आपके पास सर्जन्स होते हैं या PFT को जो वो करते हैं, कैरी आउट करते हैं, वो उन्होंने वीडियोस अपलोड की हुई होती हैं, एंड वी वॉच देम. स्टैटिक पेन को आप घर में ऐसे ट्रीट करें, ये एक्सरसाइज करें. दैट्स वियर्ड माय प्रॉब्लम, दैट वर्सन माय प्रॉब्लम.
Yeah, so that is very difficult. You know, so Google is not everything. Social media is not everything. I don't think you would like I would not recommend anybody to do any kind of internal treatments themselves by just watching a video. That's just not done. And jo people jo dalte bhi hai, I'm not a big fan of that, because you know that is something that needs a lot of supervision in the beginning. मैं अपने patients को जब discharge करने जाती हूँ तभी last 2-3 sessions में मैं उनको सिखाती हूँ कि वो घर पे कैसे कर सकते हैं with wands and stuff like that. But they should have worked with me. I need to put my hands on them, see how their body is responding. ज़्यादा बढ़ रहा है, कम हो रहा है, उससे tension. Are they able to tolerate the pressure that I'm putting? Do they know where to use the wand and you know find the exact location? कितनी सारी चीजें हैं वो सिर्फ वीडियो देख के, you know, it's not advisable. I wouldn't advise that.
Thank you so much. That was all from my side.
Yes.
Thank you so much, Haiza. Is there anyone else who has any question? There is someone who is trying to join in right now, so I don't think I will let them in because we are almost done. So, Tuba, आपका कोई सवाल हो या anybody else who has any question, please let us know. Otherwise, we'll thank Dr. Aparna.
Hello, Assalamualaikum.
Walaikum salam.
Salam.
डॉक्टर सॉरी, मेरा शायद इससे रिलेट शायद क्वेश्चन ना हो, बट मैं अभी तक डायग्नोज नहीं हुई हूँ. मेरी शादी को ऑलमोस्ट 3 इयर्स हो चुके हैं. मेरा एक 1 ईयर बेबी बॉय है. तो मैं शादी से पहले जो मेरे पीरियड्स टाइम्स होते थे वो मुझे जस्ट पीरियड डेज में होते थे.
हाँ.
तो वो ऐसे होते थे कि मैं अपनी फैमिली से कहती थी कि बाकियों को ऐसा पेन नहीं होता तो फिर मुझे ऐसा क्यों पेन होता है. तो शी सेज कि ऐसा होता है, कोई बात नहीं, किसी किसी को ऐसा ही होता है. तो ये फैमिली में ऐसा था, तो मैंने ज़्यादा फोकस नहीं किया. आफ्टर डिलीवरी सिजेरियन के बाद मेरा सी सेक्शन हुआ था, तो मेरे डॉक्टर्स ने जिन्होंने मैंने सिजेरियन किया था उन्होंने फिर मुझे बताया कि सुबह मैंने आपकी राइट ओवरी पे एक एंडोसिस्ट देखी है, चॉकलेट सिस्ट है. तो जो आप पहले आती थी कि आपका जो पेन होता है वो शायद इस वजह से होता था, जो हम उस वक्त डायग्नोज नहीं कर सके, लेकिन मैंने अपनी आंखों से देखा है कि आपकी राइट ओवरी पे सिस्ट है. इसके बाद फिर मैंने जो पीरियड क्रैम्स है ना वो हर टाइम होता है मुझे वो पेन. लाइक वो अगर मंथ का वो पूरा साइकिल जो है मुझे वो पेन रहता है, वो पेन मेरा नहीं जाता. तो स्टिल अभी मुझे पीरियड्स को 7 डेज हो चुके हैं, बट आई एम स्टिल इन पेन. मुझे वो अभी भी पेन हो रहा है. डॉक्टर लाहौर में बहुत सारे डॉक्टर्स को चेक करवाया है, बहुत हाई प्रोफेशनल डॉक्टर्स थे, तो वो कहते हैं कुछ भी नहीं है बेटा, आप पैनाडोल लें दर्द को, आप इसके अलावा कुछ भी ना करें। तो मैं तो दिल हार के बैठ गई हूँ कि शायद इसका कोई सोल्यूशन नहीं है। तो
सोल्यूशन मतलब आप ये काम कर सकती हैं कि आप कहाँ पे हैं, आपके वहां पे कोई पेल्विक फ्लोर थेरेपी है?
मैंने ये फाइंड आउट नहीं किया, अभी सर्च नहीं
ओके,
किया इसका।
तो यू कैन फाइंड आउट दैट पार्ट। अगर पेल्विक फ्लोर फिजिकल थेरेपी है, उससे चॉकलेट सिस्ट और जो एंडो का प्रोसेस चल रहा है आपके बॉडी में, उस पे तो ज्यादा फर्क नहीं होगा। बट लाइक आई सेड, there are a lot of other things. You also had a C-section, so you had a childbirth experience. आपके 9 months वो fetus carry करने से वो muscle stretch और they've undergone a lot of change. शायद ऐसे हो सकता है कि उसकी वजह से भी you have pelvic floor dysfunction in parallel with the endo. राइट, तो आप ये कर सकते हैं, आप पेल्विक फ्लोर फिजिकल थेरेपी ट्राई कर सकती हैं, या व्हाटएवर I'll follow my session up with like to do's जो आप easily follow कर सकते हो घर पे, breathing exercises, movement, stretches. I'll share it with Natasha within a week's time. At least get started with that.
Okay,
And then I would highly recommend. Yeah, and I would also highly recommend to see an endo specialist. Maybe Natasha can provide you with the resources जहाँ आप रहती हैं, अगर कोई doctor specialize in endo care, क्योंकि this is not something that will automatically fix itself. And the more you endure it, the worse it will get. I hate to say it. This is not, I'm not trying to scare you, but I'm trying to tell you that you have to do something about it. You really deserve to be heard and you really need that support.
So एक चीज है डॉक्टर अपर्णा ने जो हाईलाइट की, मैं सबको बता भी देती हूँ, दैट इज के एंडोमेट्रियोसिस स्पेशलिस्ट को देखना बहुत जरूरी है। वो क्यों जरूरी है? क्योंकि मैं फॉर एग्जांपल आई गॉट माय एमआरआई डन, और वो भी मुझे डॉक्टर मधु ने ही रेफर किया था कि यू शुड गेट एन एमआरआई डन एंड शेयर दैट विद मी। तो मैंने उनके साथ कंसल्टेशन की थी, उन्होंने मेरी एमआरआई इमेजेस देखी, उन्होंने मेरी पेपर रिपोर्ट नहीं देखी जो रेडियोलॉजिस्ट ने बनाई थी, बिकॉज दे डोंट नो, रेडियोलॉजिस्ट डोंट नो व्हाट एंडोमेट्रियोसिस इज और वो कैसा लगेगा ऑन इमेजेस। मेरी डॉक्टर मधु ने इमेजेस देखी थी, वीडियोस देखी थी, एंड बेस्ड ऑन दैट शी हैड आइडेंटिफाइड कि एंडोमेट्रियोसिस के लीजन्स अभी भी हैं, एडिशंस हैं एंड एडिनोमायोसिस भी है। तो एक एंडोमेट्रियोसिस स्पेशलिस्ट का डायग्नोसिस इसलिए बहुत जरूरी होता है क्योंकि वो एक डिफरेंट पर्सपेक्टिव से देखते हैं। तो उसके लिए तूबा आप हमारे उसमें होंगी, राइट? ग्रुप में है, राइट? तो यू कैन रीच आउट टू मी एंड आई कैन ट्राई एंड कनेक्ट यू टू डॉक्टर मधु एज वेल, या फिर इवन के जो भी डिफरेंट डॉक्टर्स अवेलेबल है मैं उनसे आपको कनेक्ट कर दूंगी। बट फॉर डॉक्टर अपर्णा, थैंक यू सो मच। आई नो बिजी डे अहेड ऑफ यू, एंड जो भी कोई भी और मजीद क्वेश्चंस होंगे तो आई विल डेफिनेटली सेंड देम टू यू। एंड जो यहाँ पे मौजूद हैं उनके किसी भी किस्म के कोई सवाल है, काइंडली यू कुड लीव दोज मैसेजेस और ऑन माई ईमेल। आई एम गोइंग टू शेयर माई ईमेल ओवर हियर। आप लोग मुझे ईमेल कर सकते हैं जो भी आप लोग के सवाल है और मैं डॉक्टर अपर्णा के साथ शेयर कर लूंगी। तूबा, फॉर यू आई थिंक यू शुड गेट इन टच विद मी एंड वी शुड फाइंड आउट अ वे कि आपको कैसे हेल्प कर सकते हैं।
ओके, थैंक यू सो मच, मैं आपको कनेक्ट करती हूँ।
Definitely. Thank you everyone who joined. Thank you Dr. Aparna. One last thing from you is कि कोई ऐसा मैसेज आप देना चाहेंगी, because every woman including myself, especially for endometriosis, had been told that the pain is in their head. So is there anything you would like to tell these women? Yeah.
So I'm just gonna leave you guys with this. If you can take away this one message from me, ki the pain is absolutely real. Don't let anybody tell you that the pain is in your head. Don't let anybody tell you that you have to live with it. Don't let anybody tell you कि you just have to tolerate it and endure it and sabhi ko aise pain hota hai, because that just boils my blood and it's so not true. ये करने से सिर्फ you're making things worse for yourself. So agreed के इस field में awareness काफी कम है. A lot of people don't know that there are a lot of different therapies, non-invasive ones, invasive surgeries. There's a lot of advancement going on in this world, but nahi available है सब लोगों को. And thank you Natasha, thank you Eamon for actually doing this kind of forum, which is really a genuine effort to spread the word, and that's all we can do. अगर आप जाके और 5 आपके नेटवर्क पे 5 लोगों को ये बता सकते हो, or someone comes to you and tells you that, oh, I have this, and you are able to tell that person, share this information with that person, we have already probably reached 100 people. If every person that is on this call shares this information with another 5 or 10 people, imagine how many lives we are going to impact. Okay, so all I want to say is your pain is real, you deserve the care. Care is absolutely available. So don't you ever think that you're alone and you just have to endure this and live with it. Absolutely not. So, you know, and I am very passionate about this work. So please keep me in the loop, Natasha. I would love to be a part of your support group. You know, whenever I get a chance, I will answer the questions. I am more than willing to do more sessions like this. And I know that it's on me to make the video, not just of the 360 breath, which will be very superficial, like super duper beneficial to everyone. तो वो मैं करके अपने Insta पे, you know, I'll share it. I'm sharing my Insta handle with you guys. It's the same as my practice name.
Okay.
And please, if I can help in any way.
हमारा एक एक्सपर्ट ग्रुप है जिसमें सारी लड़कियां हैं, बिकॉज वी हैव अनदर ग्रुप जिसमें लड़के भी हैं, बिकॉज आई रियली वांट बॉयज टू बी अवेयर ऑफ दिस टू.
Yes, yes.
They don't know what a woman goes through. So
Yes.
thank you for all the men here as well who support these women who are in chronic pain.
Incredibly important. Yeah.
तो एक एक्सपर्ट ग्रुप है जिसमें सिर्फ लड़कियां हैं. And we are, I will try to include you in that too. और जहाँ पर आप जब भी help कर सकें तो please do that.
Absolutely. I would certainly. And if you guys are creating any content, if you guys are creating any kind of even, so I also teach pelvic floor physical therapy to other therapists who are not trained in it. So if you know, if in the future, just
In the
planting
future,
the seed.
definitely.
Yeah. I would love to do that because I love teaching. I love spreading the word. I just am extremely passionate about this field. So, you know, just know that I am here in your corner.
Okay. Thank you so much for partnering with us. And She Deserves Care की community की तरफ से आपको भी बहुत thank you that you took out so much time for us.
Thank you. Thank you, Natasha.
Thank you. Have a good day.
Thank you, everybody that took the time and attended this.
Thank you.
Okay.
Thank you so much.
Yeah.
Bye.